Hi guys. So, on average, according to FBI statistics, 450 children are murdered by their parents each year. So I thought it was important, we both did, to go over some of this stuff. So, when a parent, either the mother or the father, kills their child, infanticide is the intentional killing of a child under 1 year of age. However, after the age of 1 year, the act is defined as filicide. These acts can be shocking for the community because parents are expected, to protect and care for their children. You are probably familiar with cases like Chris Watts, who went on trial for triple murder of his pregnant wife and his two daughters, who were both toddlers. Then there's the case of last week, Lindsay O'Cleary. She was a labor and delivery nurse who was arraigned from actually the hospital bed because she had killed her 3 children. She allegedly strangled them, her infant son, her 3-year-old son, and her 5-year-old daughter, before jumping actually out from a second-story window. So, too often, because of the way these cases are presented in the media and in popular films and TV shows, we believe that those who commit these crimes are mentally ill. However, the most important thing I want people to know is that there are multiple different reasons why parents kill their children, and mental illness may or may not be involved. May not have a role in each individual case. It is critical that we never presume why a parent killed. Lumping together mental illness and homicidality risks further even stigmatizes, many who have never been and will never be homicidal. And it can prevent people with mental illnesses from getting the help they need, right? So, police reports and evidence are often crucial. Interviews, especially after the time of the killing, can be immensely helpful. Obstetric, pediatric, and child protective services records provide clues. Any mental health records from before and immediately after the homicide can provide valuable insights. I have a note here. Because I did want to tell you guys, by the way, I am not supporting these crimes, especially on children. I just want to provide, some insight, shed some light on this epidemic. So, or at least the parents' possible state of mind. Anger, greed, hatred, and revenge, feelings any one of us, who has lived in a family might experience at some point, can be seen even in various types of family murder. In cases of fatal maltreatment, though, the most common pattern, the child dies at the end result of abuse or, neglect. Often these children have experienced that treatment over a period of time, and one day their body cannot bounce back. Occasionally, however, their death occurs at one-off substance, abuse or neglect. In these cases, mental illness or substance abuse may be involved, but so may be a personality disorder or parenting struggle. Alternatively, in instances of unwanted child filicide, the parent's needs or wants win out over the child's life. This is commonly described motive in neonaticide cases in which an infant is killed at birth, often after a hidden pregnancy. But a child can be unwanted at any age, and for a range of reasons, such as the parent, desiring a child-free relationship, can even occur later in life after even having some kids. So here the parent usually is not thinking of the child as their own person, but rather as someone who is fate the parent ultimately has control over, in cases of the partner revenge. Also, I want to talk about, a parent kills their child to get back at a partner, or an ex, and emotionally wound them. This may happen in a custody battle, for example. In contrast, though, these first 3 motives, the much smaller populations of those found not guilty by reason of insanity, and those who commit, filicide, suicide, tend to have an altruistic or acutely psychiatric or psychotic motive even. So in an altruistic filicide, a parent kills the child out of love. The mother or father may be psychotic and out of touch with reality, or at least depressed, at that time. If the parent is psychotic, they may be experiencing, delusions that a fate worse than death is about to befall the child, and thus believe they are sparing the child and from, I guess, an outcome, by killing them gently. A parent who is, severely depressed, though, may plan their own suicide and not want to leave their child alone, in this cruel world. They're thinking it. We also see altruistic motives, though, in other types of families, murder anyway, such as one older adult killing a partner who is medically unwell or suffering, like from dementia. In the acutely psychotic cases, a parent calls, with no rational reason. I'd say, for example, they'd be, when they think they hear, from the command of God or something in the context of like a psychosis. As these cases continue to occur, we should not make assumptions or correlations where they do not and should not exist. Most people with mental illness would never harm their own child. And at least, a great many parents, who kill are not suffering from a mental illness, though at times it turns out to see. The mothers were often poor, socially isolated, full-time caregivers who were victims of domestic violence or had other relationship problems, disadvantaged socioeconomic backgrounds and primary reasons, responsibilities, for the reason the child was even common. So persistent, crying or child factors were sometimes participants for the filicide. Some moms had previously abused the child, while others were mentally ill and devoted to their child. Neglectful or abusive mothers were often substance abusers. Many of the perpetrators had depression or at least a suicidality at some point. If not themselves, their parents or their spouse, did. And in the correctional population now, though, I'd say filicide mothers are frequently unmarried, unemployed, abuse victims who had limited education and even social support. Some even have decreased intellect, and a few consider the child victim even to be normal. Also, strong notes of partner relationship problems, I've noted, and ultimate parent difficulties, crying for the child, were frequent. There is also a strong difference in crime when you consider a child killed suddenly without much planning versus like a parent who contemplates first about killing their child or children for, days to weeks prior to their killing. I find the Infanticide Act fascinating because this law allows mothers to be charged with manslaughter rather than murder if they are suffering from a mental disturbance. The law was originated based on the outdated concept of what was called lactational insanity, but the public's desire, to excuse sympathetic women caused, reluctance to after the law often was put into place, because the women that fall under this law receive probation and referral to mental health treatment rather than incarceration. Also, opponents of infanticide laws point out that fathers are granted far less leniency. I find it disturbing when you compare cases of similar crimes of a mother versus one of a father, because the punishment is quite different. There, for community education, I think is important, right? Support services for mothers and fathers to accessibly get psychiatric services, especially for at-risk populations prior to any crime, committed are needed. I definitely think early intervention, I've seen over the years, and I'm sure you'll agree, helps to protect these children. and it's more likely to fall also to protective, child protective services even than to psychiatrists. Also, 50 states in the U.S. have mandatory reporting laws now for professionals who suspect child abuse. Parenting classes, emotional support, and emergency numbers to call when mothers and fathers, when they're feeling overwhelmed, can call, and they teach them to make their own lists as well. So I believe it can be helpful, though, in preventing, fatal maltreatment or crimes. Maternal and paternal substance abuse, must also be treated. Child protective services must remove children who are at risk of serious abuse. Mothers who are diagnosed, with Munchausen, as we've talked about, should be evaluated to see if they have engaged in, by proxy behaviors. Child protective agencies should be receptive to accepting children into their care, right, who are unwanted, even if no abuse or neglect has yet occurred. Spouse revenge. Filicide is difficult to prevent because, there is usually little warning. This behavior most often occurs after learning of spousal, infidelity, or in the course of a child's custody dispute. Sometimes a mother is so convinced that her child will be sexually abused if permanent custody is awarded to her ex-husband that she decides the child is better off in heaven even. I know evaluators now of child custody disputes should be alert for this potential. Children under age 5 may have limited contacts outside of their household and have difficulty speaking out to others, while older children often attend school and can thus reveal child abuse. In the U.S., child homicide rates peak in winter for young children, and under age 2, the summer, though, is when the older children, I find that interesting, the kids that are between ages of 5 to 14. So infant and child factors such as colic, I'd say, or autism may increase risk. These suggest a potential role, for pediatricians anyway, in preventions as well. And lastly, I want to add important note on how to explain maybe violent death to a child. I'd say let their questions guide what else to share. You do not have to describe in detail what happened unless they ask. And then you should answer honestly. You might say something like, Mommy, Daddy, or child died. She or he, was stabbed or drowned and they died. Avoid euphemisms, such as passing away or went to sleep, crossed over or lost, as they can actually confuse a child. We have to have empathy and put ourselves in their shoes simply to try and stop crimes like this from happening in the future, right? So if we care about the babies, we need to try and figure out what should the mother or father have had or needed, and now the child, be more successful with them at parenting, whoever it is now, under the circumstances, to even reduce for them trauma, let alone repeated cycles, right? Okay, guys. Have a great day. Hope this helps. Bye.